all year long. We've been following the frustration a lot of people are feeling, though, as they try to schedule a COVID vaccine. We've been hearing real horror stories of people on the phone or computer being there for hours as they try to book a slot. Well, what if you don't even have a laptop or the ability to sit on the phone all day? Paula Tutman looks at one program in Wayne County working to close the gap to vaccine access. Paula.
Not everyone has a smartphone, not everyone has a laptop or even internet access, and certainly not everyone has the ability to sit on the phone or a laptop for hours and hours trying to score a scheduled COVID-19 vaccine. And that's part of the disparity of who's getting the vaccine and why.
Next floor, go ahead on in.
There's sheer excitement in Southwest Detroit today as people who've had no shot at getting a COVID vaccine enthusiastically line up for the shot.
Oh, it's real exciting. You just got to stay warm.
Olivia has struggled to find the shot or get on a list.
Well, I went through my psychiatrist agency, and they go through for your physical through another doctor they have on Jefferson, and they said they couldn't get it.
Blacks, Latinx, and other people of color and those living below the poverty line are more likely to contract COVID-19 and die from it, according to every single study and CDC statistic. Yet, a fraction of people who fall in marginalized populations are getting the vaccine compared to whites. For many, it's a simple case of lack of access.
Disparity is not only in healthcare, disparity is also in access to technology. You know, when we talk, look, Paula, you and I are communicating in this forum. Look, prior to this, we would have been in person having this conversation. For most of the folks we serve, yes, you might be able to give them a laptop, but are you also going to provide internet services for them? Are you also going to provide the tutelage that would be needed to operate these things?
The Kaiser Family Foundation has been tracking who's been getting the vaccine and who hasn't. Take a look at the difference between blacks, Hispanics, Asians, then whites.
Folks are trying to put food on their table, making sure that they have a roof over their head. They're not thinking, let me buy that computer and reach out to Comcast or Xfinity to set up my network. That's not part of the calculus.
This week, a leveling of the playing field for 3,000 Detroiters and counting because of the partnership between the City of Detroit and Detroit-Wayne Integrated Health Network, which has identified seniors, low-wage essential workers, and clients in the mental health system to get fair access to the vaccine.
Just yesterday alone, we were at one of our locations, and over close to 200 folks came out. That's 200 people that would have either had to wait or may not have even had access at all.
By crisscrossing the city and having on-site vaccine locations in which people are picked up and even ferried to the site or the vaccines are taken to them, this partnership hopes to vaccinate as many as 10,000 people between now and next week. Paula Tutman, Local 4.
Yeah. All right, Paula, the current program is for citizens of Detroit, but the Detroit-Wayne Integrated Health Network is looking for ways, we're told, to partner with other cities in Wayne County, hoping to expand their efforts to reach people who also don't have easy access to the vaccine. So we'll continue to follow it, and we are continuing to track access to vaccines all over Metro Detroit. Our web team has assembled a list of every health department and health system, so you can find a link to get started at clickondetroit.com.